the etiology of this disease is a pulpal disease or trauma, and the signs and symptom or present of this disease is pain and no radiolucency and no abscess. As we said, the pain, radiolucency, and swelling or abscess are the three things that I will use during my diagnosis. In this situation, we will have pain, we will have no radiolucency, we will have no abscess. The future or the treatment of this disease is to remove the cause or do an endodontic treatment. If it is caused by a high spot, we will remove the high spot. If it is caused by a pulpal disease or irreversible pulpitis or necrotic pulp, we will do an endodontic treatment. Here I would like to indicate that there is something called as subacute periradicular periodontitis, which has a milder pain than the pain felt by the acute periradicular periodontitis. I also want to mention that there might be some minimal radiolucency in some cases of the acute periradicular periodontitis, but in general it is very painful, and it is very painful on palpation and percussion. It has no radiolucency and it has no abscess. The second one, which is the chronic periradicular periodontitis, which is the past of it or the etiology of it is a pulpal disease or trauma also, and the present or the signs and symptoms of it are it has no pain because it is chronic, and it has a radiolucency because it is chronic and old and the destruction is walking around the bone, and it has no abscess because it is not an abscess, it is a periodontitis. The future or the treatment is to remove the cause or do endodontic treatment as the acute one. Here I want to indicate too that acute flare-ups may occur and pain may occur, but in general the chronic periodontitis has no pain, has an obvious radiolucency as we can see here in this picture, and it has no abscess because it is not a periradicular abscess. The third diagnosis, which is the acute periradicular abscess, or as we also call it as acute alveolar abscess. The past or etiology is a pulpal disease mostly, and the present or the signs and symptoms of it are pain because it is an acute disease, radiolucency, and abscess because it is an abscess from its name. The abscess is a swelling with rapid onset. Guys, when I have acute abscess, that acute abscess from its name, acute means painful, abscess means that there is an abscess, but in this case the abscess picture is a swelling with a rapid onset. The treatment here is a root canal treatment procedure. The fourth situation or diagnosis is the chronic periradicular abscess, or as we also call it as the chronic suppurative periradicular periodontitis. The past or the etiology of this disease is a pulpal disease mostly that leak out into these tissues. The present or the signs and symptoms of this disease are it has no pain because it is a chronic abscess, it has radiolucency and an abscess because it is an abscess, and most importantly it has a sinus tract. Guys, this word sinus tract is a pathognomonic thing and picture and feature of the chronic periradicular abscess. Every time you read in the exam these two words, sinus tract, that means we have a chronic abscess. In this situation, we may have some pain, some mild pain, but in general, it has no pain. But the radiolucency and the abscess, which presents as a sinus tract, is a must. The treatment is a root canal treatment or an extraction in some cases also, because there will be a mobility in the tooth, and if the tooth is hopeless or it is not restorable, the extraction will be better than the root canal treatment. The fifth diagnosis, which is cellulitis. Guys, cellulitis is the picture of the cardinal or the traditional five signs and symptoms of inflammation that we have studied in pathology. Cellulitis, it is an itis, it is an inflammation, so that it has a swelling. That swelling will push the nerves and leads to pain, and it has so much blood in it so that it is red and hot, and because of this swelling and pain and redness and fever, there will be a malfunction in the organ involved with cellulitis. But cellulitis specifically, it is not just an inflammation, but it is specifically the inflammation of the skin and connective tissues beneath it. Okay, in this case, we have the cellulitis, or the inflammation of the skin and connective tissues caused by a tooth and pulpal disease. Okay, because we may have cellulitis in the leg, we may have cellulitis in another parts of the body, but here in the face is caused by as a consequence of a pulpal disease. And finally, the condensing osteitis. The condensing osteitis is characterized by the presence of no pain, no radiolucency, no abscess, but radio-opacity. This is the only diagnosis that is characterized by the presence of a radio-opacity. So that, can you forget this in the exam? Answer me. Can you forget it? No. It is the only one that has a radio-opacity. So that the condensing osteitis, it is the only one that has a radio-opacity. So that don't you ever forget this in the exam. The summary for the periradicular diagnosis: we should know that all acutes are painful and all chronics are not. Mostly. Not always, but mostly and in the vast majority of the cases. Okay? We should know that all no swellings are periodontitis and all swellings are abscesses. This is very obvious. If we have an abscess or a swelling, that means it is an abscess. And if there is no swelling or no abscess, that means it is only a periodontitis. And after knowing that this is a periodontitis or an abscess, then we will know that if it is painful, it is acute. If it is not, it is chronic, and so on. For the abscess, if it is painful, it is an acute abscess, and if it is not painful, it means that it is a chronic abscess. The cellulitis is a cellulitis, and it has the cardinal and traditional 5 signs and symptoms of the inflammation that we have studied in pathology, and the condensing osteitis is the only one that has a radio opacity. Thank you for improving yourself by listening to this presentation. Always try to know, spread knowledge, and construct the world. Be kind to others, and that is for the greatest benefit to the humankind.